make sure that we address your questions. So there's two categories of questions. There are questions that pertain to Laura's challenge specifically, and there are questions that pertain to the process or the logistics for the whole challenge, and we'll take those separately. So we will start taking questions for the challenge, but first let me share my screen. And JC, you froze, so I hope, okay, we're gonna get her back. All right, so I'm gonna share the deck that you've already seen if you're able to attend the event on Thursday. All right, so Laura Gentry is here with us, like I said, the CEO of the Medical Center of Peach County, which is in Middle Georgia, towards the southern part of Middle Georgia, right, Laura? And this is what we want to do today. That's what I mentioned as part of this presentation that's on the website, GA-healthcareinnovationchallenge.com. You can also find those slides on the website, as well as the recording from Thursday. And these, you will recognize the slides if you're able to attend on Thursday. So Laura, I'll let you go ahead and tell me when I can go to the next slide.
Okay, so this is our beautiful hospital. It's 8 years old. It's the Medical Center of Peach County. Next slide. We are located in Byron, Georgia. However, the county seat of Peach County is Fort Valley, Georgia. We're a 25-bed critical access hospital. We're a small hospital, but we're very busy. And then we have a rural health clinic that's located in Fort Valley, Georgia. Next slide. Fort Valley is, it's not a very growing community. It's an older community with only 9,000 residents. Household income's about 40,000 as compared to the state of 58.7. So you see it is on a lower income, a lot of older homes, no big businesses, no big grocery stores. We have the Food Depot and of course Dollar General in every corner, but no big grocery store chains or anything like that. Next slide. So the way this all started was the Medical Center of Peach County, our inpatient unit is an adult unit, but we do have an emergency department. And a couple of years ago, I met a pediatrician that works with the Pediatric Environmental Health Specialty Unit at Emory. And he told me about a lot of work that had been going on in the city of Fort Valley, which is about 10 miles west of the hospital. And when you go west of the hospital, it's very, very rural. It's about 90 miles or 90 minutes going west to the next hospital. So it's a real rural community, beautiful farmland. Anyway, his project, he told me about a student at Fort Valley State University that was working on a project with pediatric asthma and trying to understand environmental factors that impact asthma attacks. And the project grew really large to involve all these agencies here, the EPA, the Pediatric Environmental Health Unit, a specialty unit at Emory, Break the Cycle Inc., and Emory University. And what they were trying to do was understand pediatric asthma and the influences of the environment, and then also what caregivers and the children knew about their asthma and how to manage it. So that kind of forced me to look at what we're doing at the hospital with, you know, what kind of patients are we seeing? And we realized that we actually do see a fair share of pediatric asthma patients that come to the hospital emergency room. Now, mind you, when they come to the hospital emergency room, they are not being managed very well. They're very sick at that point. So a lot happens before they ever make it to the hospital emergency room. The next slide shows you a little bit of what our volumes look like, about 72 to 77 cases a year for 17 to 19. And you can see by age, most of them are younger. So they're very dependent on, you know, their caregivers to help them manage it. But the goal of the community, of the project, they wanted to see what they could do to help the children understand their asthma and manage it as well. The next slide just shows you our current issue. We realized as we started working with the group that I mentioned earlier, and then our own internal knowledge or understanding was that children and their caregivers don't understand their asthma. They don't understand what things trigger their asthma and how to manage it before it gets to the point that you have to come to the hospital. So we wanted to understand what could we do to help educate the children and their caregivers about asthma before they ever have to come to the emergency room for care. And then also what kind of triggers happen outside of home. So if you've ever experienced asthma, you can have an asthma attack related to sporting events, running or things like that. So we realized there was such a knowledge deficit in there. And then, of course, now with COVID, we fear that they won't be seeking care because they're afraid they're going to get COVID. And so could they possibly be postponing care for their asthma? The next slide, this slide just shows you all the influences of that in the environment that have on health in general. All these impact asthma, children with asthma as well. As I mentioned, it's an older community. The homes are older, a lot of old fallen down buildings, limited financial income, limited education of the adults. A lot of these children live with grandparents or foster parents. So this cycle has a really big impact on the children. On the next slide. So when we started thinking about a solution, we're not talking about a child that's acutely ill. We wanted a solution that could help them manage it so they don't get acutely ill, because you can manage asthma well. So we thought, wow, some kind of digital access might be a great potential solution to the problem that would be fun and help the children and their caregivers understand asthma, identify our triggers, and know what to do if they start having an asthma attack. Like I said, we wanted it to be fun. The other thing, in rural communities, there's not we have minimal broadband requirements would be a must for this solution. And then, as I mentioned, we want it to be for the children and the caregivers. The next slide. And then, of course, our goal is to increase literacy and health literacy and understanding of asthma, and improve overall health of the community. When I originally did these slides, we wanted to see if it had an impact on their emergency department visits, but when we first started working on this, that was a goal, but then COVID hit, and emergency department visits are down all across the board, all across the state, other than COVID visits because of fear of going to the hospital. So that's probably not a great measurement anymore. We also want whatever our solution is to be sustainable. So that's a little high-level view of our project and what we were hoping to find a solution to.
Thank you, Laura. That was great. I want to add something that Laura said on Thursday. When we're talking about parents and caregivers, Laura mentioned that a lot of those children live with their grandparents. So if you're thinking ahead and you're thinking about how, who your users are going to be, you have to think about a pretty significant range in generations, probably 3 or 4 generations, depending, 3 actually, well, with the children, actually 4. So if you think how to engage the users, your users will be very different in terms of their digital literacy, and in terms of how comfortable they are engaging with a technology-based solution. So think about that. I want to stress also what Laura said about the social influences of health, because this is more of a community health project than an acute care project, like Laura mentioned. So bear this in mind. We do have contacts for you in Fort Valley. If you so desire, let us know. Laura, can you mention what type of contacts we have? I know we have the Head Start program director, who's kindly offered her help, Monica Shakespeare, and I can put you in touch with her. Anybody else comes to mind, Laura?
So Medical Center Peach County is part of Navicent Health. So we do have a children's hospital that's located about 20 miles from us. They may be able to help as well, because they do, as I mentioned, the acute care with asthma. And then there is an educator that may be able to help us. So that's a contact. And then the mayor, believe it or not, got very involved in this project. The original project, there was a lot of trouble having people in the community trust all these organizations in the city, and so she was able to really bridge the gap there. So I know she has great knowledge. And then, of course, the pediatrician that I mentioned earlier, he is not located in Fort Valley, but he got ultimately involved with it very closely, and I believe he would be a great contact as well.
Thank you, Laura. And about this pediatrician, he has written a few reports about the projects that have been carried out as part of the background slide that Laura presented to you. And he's willing to share those documents with me. So get in touch with me, or one of the organizing committee members, and we'll be happy to share those documents with you. It will give you some background about the social influences of health of Fort Valley, what's been done in the past, what the learnings have been, bearing in mind that this project that we are tackling right now is slightly different because it's focused more on the knowledge gap than on putting sensors in the home or the other projects that you will see there in those documents. All right, what questions do you have? And you can ask them in the chat, or you can just unmute yourself and ask them live.
Isabel, this is JC. Do we want to go ahead and touch on those two questions that came in earlier that we got in from the web?
Mm-hmm.
Let me go here. I'm gonna pull up that first.
I believe you have somebody trying to ask a question.
Oh, okay. Well, let's go there first then.
I think Ogie.
Hi. I think I sent my questions to the website, but let me start. Probably all this has been explained already, but you guys are going to give medical and pharmacy claims, right? For certain amount of people, correct?
Yes.
And it's going to be how many years for, I believe it was like 35,000 or something like this.
What was the question? Now,
How many consecutive years of claims?
Well, remember, these are children, so these would be Medicaid. These wouldn't be Medicare.
Laura, I'm wondering if there is confusion with the other challenge. So I should have mentioned that when I introduced the Q&A today is, we had two challenges that we pitched on Thursday. And sir, is your question more related to the rising risk beneficiary challenge?
Well, I'm interested in both.
Okay.
But, okay, it's going to be the same question for you. So in order to build model, we need data. How many children, data for how many children you are going to give us for how many consecutive months?
Okay, so we have the ER admissions data for the medical center of Peach County that we can share. Anything else, Laura, that we can share?
Well, remember, I think the pediatrician's report would help us more, because remember, we're trying to even look at children that never have to come to the hospital. If they come to the hospital, they're really sick. So we were trying to even get into homes, because I would only have my hospital information. So, what other children are out there. And I think the pediatrician's report may be able to help us more there with how many homes they were involved in and what that looks like. So I think we can get that for you.
Well, guys, I'm sorry, but when it goes about predictive modeling, and that's my life, the first question is, how rich is the data set? Because garbage in, garbage out. If we don't have enough data, you cannot build a good model. And when we talk about enough data, usually predictive models in the field of healthcare use like at least several hundred attributes, maybe 1,000. Diets, drugs, procedures, socioeconomic attributes. So there should be some preliminary information about how many children.
Hey Augie, this is AT. How are you?
I'm feeling great. How are you?
Good. Why don't we table this one just to move on? Because I think the data is one part of this challenge, but there's other elements of it too. So maybe we can circle back later on more details on the data side. The other challenge around the rising risk is going to be much more data intensive, and I think those questions are probably better suited on that challenge Q&A at 2 this afternoon.
Well, correct me if I'm wrong, but one of the expectations of this challenge is to predict children at risk, right? So there are two potential approaches.
Yes, there are multiple approaches. I'm just suggesting, for interest of time, maybe we can share some of the more detailed data questions, which are all good questions. Tackle that towards the end.
Okay.
Well, and I'll just say too that, we're really not trying to predict the asthma. What we're trying to do is educate those that we know have it. So I understand your question about predictive data. I understand that, especially when it comes to the hospital. But I think what we were hoping to accomplish too is really more a tool to educate those that we know
Okay.
are
Okay.
sick.
That is my wrong understanding that identifying avoidable acute events of asthma for children is going to be the main focus. So I'm sorry, I misunderstand.
No, I think could be another piece that comes out of it. I mean, yeah. I really do. I think that's important information as well. So we will definitely look at that.
Laura, one question here is, can you provide the name of the pediatrician specifically you're working with or on site?
Isabel, is he comfortable with us, Sharon?
Yes, and he can advise us, as a program advisor, but he's not full-time with us. He's not an employee of Navicent Health. He's an employee of Emory. His name is Dr. Leslie Rubin, and you will see his name in the reports that I mentioned at the beginning that we can share with you all. I will ask you that you don't contact him directly. You go through Laura and I, and we will field the question, just because he has a full-time job and seeing his patients. He's a behavioral health subspecialist, and he's seeing his patients remotely. So he still has a full-time job.
Awesome, thank you. Another one we've got here is, so we've got from Aldo. He said, can you share your thoughts on educational approaches that have worked in your community in the past?
Well, I was just going to say, I don't want to be leading or anything like that with what we were thinking, but our concern is that traditional education approaches have not been as effective as we want. For example, there is an asthma camp that the Children's Hospital in Macon holds, but the problem is when you live out in rural communities, it's hard to get to the camp. Classroom type education can be a little boring at times. It's more of a traditional approach. So we were trying to hopefully get real creative. I know the Head Start program does have a educational opportunity that they provide for the kids that are involved in Head Start. So like I said, I didn't want to be real leading, but I guess we were kind of looking at, is there something you could do that they could use their phone with, or some kind of social app or something like that they may, that's not traditional education, that's something very, very outside the box to help them understand.
Awesome.
And Laura, I have a follow-up question for you on this one. Who will provide the educational content? I have my idea, but I wanted to hear your thoughts.
So we do have a children's education program through the Children's Hospital in Macon. There's a respiratory educator that teaches the children. So that would where we could get our content through her, or through the Children's Hospital. Exactly.
I was thinking about her as well. And they're very involved with especially the inpatient asthma kids and their families at the Beverly Knight Olson Children's Hospital in Macon. So, they see those children all the time.
We have another follow-up question. If I can, it looks like it was the first one there. What types of social determinants of health data do you currently utilize or need access to identify those adolescents?
So we actually do community health needs assessment every 3 years. We're actually getting ready to do another one, but we just did one, and it just shows it provides a lot of information about the households in Fort Valley, from educational level, income, health disparities, health of the adults caring for the children. So we have a lot of data that we received from our community health needs assessment. We actually hire an outside agency to do that for us. So I do have that information.
Laura, are you able to share the whole community health needs assessment from 3 years ago?
Yes, it's actually on the website. Our website is navicenthealth.org, and then you click on the Medical Center of Peach County, and you will see our community health needs assessment.
Wonderful, thank you.
And as you see that, you know, you look at the adults, and you have, you know, just realize that it's when you see the health of the adults, and you thinking that that's who's caring for these children. They have their health issues as well, so it's interesting.
Awesome. Let's see here. We've got another one here. How do you see us reaching the families?
So that goes back to that big team that worked on this for several years. I don't know exactly when they started. I was connected with them 2 years ago, and they had already been in progress for about 3. And they had developed relationships. Also, there's the director of the Head Start program. I think she has connections that can help us connect with these families as well. So we do have some people that had established relationships with these families before.
I like this question because it's raising the important point of doing customer discovery. So this is something that we expect as part of this program for you to be curious and go, and it's hard to go there, right? In person, we understand that, but there are ways to reach out to the community. And this director of the Head Start program, she's available via phone, and she's willing to share any information that she has. She can tell you about the Head Start program, about the parents that she works with, and why. And she's involved more with the younger children, which is the ones that tend to go to the ER the most, per the data that you just saw from Laura. And I know there was a question on adolescent as well, so it would be interesting to see who else we can touch base with to identify those adolescents. But right now, yeah.
I was just going to say, we're very connected with the school system as well, the school nurse. We're actually trying to work with them now to, you know, help them in the school system through telemedicine. So we do have a connection with the school system as well.
Wonderful.
Another one, maybe go back a little bit, just talking a little bit about the primary goal. Is it to provide more education or patient adherence?
Well, I think education is king. So if you're educated and understand, I think you will gain the adherence, and that's our goal. Our goal is really to help them manage and live a healthy life with not letting their asthma interfere with, you know, their life, being able to do sports or things like that. So I think it kind of goes hand in hand, really.
Okay. Yeah, great. Can you tell us a little bit more about what is the age range of the patients that you think would utilize, say, a digital mobile solution?
So I have a 4-year-old granddaughter that can work circles around me on her little iPad. So I'm thinking as young as maybe 4, 5, 6, and then of course up to 17 was the range that we were kind of looking at. And then of course for the younger ones, of course, we were hoping that it, you know, the nice blend of the caregiver as well. That's where the caregiver would come into play.
Absolutely. Okay. And then can you say where the bell curve of ages falls most heavily along those children visiting the ER for asthma?
On that one slide, it shows it's about 6, 7, and 8 years old. That's where the kids that are having the asthma, you know, the severe enough to come to the emergency department. So it is a little bit younger.
Maybe you could pull, Isabel, are you able to share that, that specific?
That's what I was working on.
Get a look.
Okay.
Hopefully this is helpful, Casey, to kind of look at the average ages and cases. I'll go ahead and go ahead.
Yeah, thank you, JC. I wanted to add that we heard from the pediatrician that this is due to the immaturity of the lungs, also a misunderstanding of the asthma triggers when, you know, often the onset of asthma happens, the first one, during those ages. So at first, you know, the parents, guardians don't know exactly what it is. So that's where you see a spike in those cases, lung immaturity, and then they kind of drop towards teenagers. So middle school and high school, you see the cases drop. Also, asthma is a disease that goes away sometimes into adulthood, something that we don't necessarily carry with us into adulthood.
But yet I do want to point out that children die of asthma attacks at that age. I know I shared a personal story. You know, I had a coworker that's nephew was 8 and getting a breathing treatment at home, and the mom went into the kitchen to go finish cooking, and when she came back, he was dead. And I think that year, I believe there were 4 deaths. Isabel, we were talking about this in 1 year related to asthma and the younger children. So deaths do occur. I do want to point out too, when you talk about data, I have a tiny little hospital. I have 25 beds. So when you're looking at our emergency department, that's just a snippet of what's happening in the community, because there are some other hospitals. You know, they may go to Warner Robins, which is 10 miles from me, which from Fort Valley, it could be about a 10 to 15 mile trip. So they could possibly be going, well, I know they are, some of them are going past us just because of where you might live in the county. So just to point that out, that's just a small little snippet of ER visits.
And Laura, I have a follow-up question to that question. Can we share the diagnostic codes? I think there's like 4 different diagnostic codes that you see in the emergency room, and we have those codes. Are we able to share that?
Yes.
Okay.
I don't have it with me, but I think we pulled it, and
yeah, I was looking at the data.
do that.
Yeah, we do have those. Okay,
yep.
Great, thanks.
One other question, you were kind of talking about different triggers and ER data. Does the ER have any data on frequency of different types of asthma triggers?
The ER does not, but the pediatricians do, and we can definitely get those triggers. That's part of the educational that we could provide as well. I mean, it can be anything from obviously cigarette smoke, that's a trigger. It can be running, that can be a trigger. You know, it can be so simple, some of the things that can trigger an asthma attack. But yes, we can provide that information.
Yeah, indoor air quality, not just, you know, in the home, but also in the school, in the daycare, in the different homes that that the child may be living in. There's a slew of triggers with asthma, so it's pretty complex.
Okay, I'm going to switch over a little bit to like a goal side of things. One question, do you have some financial and clinical data for the cost and the quality of care to establish some baseline measures and improvement goals?
We could definitely get that. Okay. Yes.
Okay. Let's see here. We got another one here regarding engaging and fun. Should this app be something that you pick up constantly and complete like a game, or is it just something light and enjoyable?
Well, when we had our little roundtable discussion, we went both directions with that. For me personally, I'm not creative at all. I want, you know, facts and numbers. So when people started talking about gaming, and that was exciting. And then also, you know, something that you could reference back and just keep re-educating yourself with as well. So I think both, I don't know if you can combine both, but that's kind of where our mind was going when we started talking.
Yeah, that's great. We were talking a little earlier, AT and I are talking about like, this is probably going to be a little bit more of a creative solution, a little bit more, you have to be kind of out of the box perhaps. So I like, Adrienne, that you're asking and thinking through that.
Well, and I wanted to say too, you know, our hope, when we started talking about this is not something we want for just, you know, Fort Valley. That was the starting point because of, you know, ever how that project started so many years ago, trying to get in the home. But, you know, childhood asthma impacts so many people. I mean, read about Break the Cycle and that organization, and then the Pediatric Environmental Specialty Unit at Emory. You really get, it's kind of mind-blowing when you see the impact that the environment and the triggers and just asthma as a whole. So, you know, our thought was this isn't something for just Fort Valley. This would be the start, but it could be something used. That was my thought anyway. I'd love to see it something big and awesome that pediatricians all over the world want to use for their children.
Great. Well, I think it looks like Jesse wants to ask a question directly, and then we'll go back to AT is going to talk through a little bit of the deliverables here in a bit and next steps. So let's go to, I'll open the floor to Jesse. And if you want to unmute, you're welcome.
Yep. Can you hear me okay, Laura?
Yes, I hear you.
So Laura, we were, I don't know if you recognize me, we were selected through ATDC to work on this project about a year and a half ago. So came down to visit you guys, and that project, we were part of steering committee. There's another member here that was another company that got to be a part of it. So it was awesome. We had a lot of momentum, but the project stalled. And I understand that this project doesn't have funding, and there were a couple of reasons why the project stalled. So, but I would love to hear from you on what's different, what's changed. Obviously, there's different people involved. Some of the people that were part of the Navicent team aren't part of this, but yeah, just what's changed and why revisit this, I guess.
So it's, you know, back in January of 19, we became part of Atrium Health.
Right.
Out of Charlotte. And when we did that, there was a lot of restructuring that went on with our innovation center. And that was the stall as different people were moved around. And Isabel can probably speak more to how that all kind of played out. So as I said earlier, I'm not creative. I'm not the thinker in this way. And as far as innovation, of course, Isabel likes to tell me I am more than I want to give myself credit for, but so that's really what caused the stall. It's just the reorganization of our innovation center. And then Isabel, everything settled down a little bit with people in places and who's where. And then Isabel actually reached back out to me and said, are you ready to start this up again? And I've been ready. I hated to see it stall like it did. But Isabel, I don't know if you have any additional comments to that.
Yeah, well, that's what happened with the integration. There was a lot of reorganization, and that impacted the innovation team as well. And now we're fully integrated, so we're back up and running. For now, I'm a team of one. So that's also what happened. We lost a few team members, and we decided to go about this a different way because ATV, HIMSS Georgia, and TAG reached out to us to do this reverse pitch challenge. And you know, and Laura was interested in pitching this again, so that's how it's coming back. It's coming back to the community in that way, and so now it's back on the table. And we realized we've lost a little bit of momentum because I understand I was not part of the original project, but I understand that there was a lot of stakeholder involved, and there were discussions happening, and it's a shame that everything stalled. But hopefully we can, you know, reignite all these relationships that have been started and the stakeholders that have been involved, and make it even better.
Just last question, just follow up. So can you explain to me why, if there isn't funding for this project, why it would be a, you know, if you think about it, when you do customer discovery, you're looking for authentic demand. Part of finding authentic demand is this a solution that somebody's willing to pay for? And I can share with you some of the other reasons this stalled. One of them was around IRB, an IRB study with children and getting children and the community involved. And so all those things are challenges, but funding is, you know, is one for an entrepreneur and for a startup to seek out and find solutions that people are willing to pay for, and solutions that people aren't willing to pay for should be viewed in a different way that may not be quote unquote authentic demand. So, yeah, I just want to understand the thought process on the priority of something like this if there isn't funding for it.
Laura, you want me to take that?
Yeah.
Yes. We, through the partnership, we're also coming in with different potential for funding. So there is no funding for the first 13 months. And that's a good segue into the next part of the session where we talk logistics and funding for the program. So for the first 13-week program, there's no funding. But after, once we get into proof of concept and beta, if we're able to co-create a solution that would really stick with Fort Valley and then could be expandable to the rest of the region and possibly the country, then definitely we will be able to find sources of funding. And it might not be the sources of funding that were discussed, Jesse, back when you were part of the project. It might be different, but we are very committed to this, and the two challenge champions are committed, and we will find a way to fund a solution if it's the right one. We just don't know right now. It's early on in the game, so that's how we're looking at it going forward. And you mentioned something about the IRB. The IRB processes have changed as well. So if this is deemed a quality improvement project, we don't have to go through IRB, but I will double check with the IRB chair to see what's the status of this, because I understand doing an IRB with children is challenging indeed, because it involves not just the children, but also their family members. Jesse, did I answer your question?
Yeah, I mean, I guess what you're saying is, I understand that this is, we're working towards 13 weeks. No one expects to be paid for the 13 weeks, I guess. But if you are chosen, it sounds like then we might look for funding, kind of a thing.
Yeah.
So that, yeah, it's interesting. Okay, thank you.
I think that, Isabel, one of the things is Jesse, good questions. The other thing I would say that part of what you were describing, that customer discovery process, right? The importance of that as an entrepreneur, is that's part of this as well, right? Is co-creating from a real problem versus applying technology and then going and looking for a problem to solve. And so that's part of working with Navicent here on this. And there is a guaranteed beta test for the winner as well. And to your point, too early to say if that goes well, it's guaranteed funding. But I think there's a guaranteed beta test. And as part of this, again, I wasn't part of the first program, but there are multiple folks on this call and part of the program that are investors, that are healthcare folks in the ecosystem, that have access to funding. And all of those things are a part of this program as well. That I think, as Laura put well, this is something that we hope is tested and tried here with Navicent, but it's something that would effectively be able to be rolled out across Navicent and Atrium or across other similar organizations as well. So it's bigger than just the one.
So at that point, somebody might be willing to pay for it, is what you're saying, right? Why would an investor invest in something if somebody if it isn't worth paying for? That is a bad investment. I don't know if any investor that is interested in solutions that people want to try but don't want to buy, right? So I mean, I understand you're trying to champion this, but the logic is a little. Again, that's a tough road to hoe for a startup and an entrepreneur. Is let's beta this, and then maybe we'll try to convince investors that sure, this person didn't want to pay for it, but maybe we can find other people to pay for it.
Yeah,
they'll say let's find a paying customer, and then you might become investable. So that's it's a
I
little
can't
backwards.
speak for other investors. I can only speak for ourselves and how we would view investments. But number one is you start with the problem before even the pain part. Pain is absolutely a part, but we got to make sure you're starting with a problem, and that's part of where this is in the process, right? Is starting with a problem.
Good morning, ladies and gentlemen. My name is Alvin Ostro. I'm the Managing Director of Research Projects International at Georgia State University. I'm the author of the Flex Business Model Canvas. I was hearing your discussions about funding, and I'm the creator of a funding model for nonprofit and government interactions or collaborations to fund projects such as yours. How that is done, of course, I can explain at a later date. I don't know if this is the forum for discussing a new model for the 21st century, how business is done in the 21st century. But the old model of the 20th century is inflexible. It has a finite beginning and a finite end, and a lot of projects go into an orphan state, or they just get lost somehow. And we need a new model to fund projects, especially projects like the ones we're talking about today in the morning and also in the afternoon. So I have developed ways of how to be able to create a mechanism where projects do get funded and they do have non-stop funding without ends, no finite issues, because our society doesn't have a safety net so far. Without the Flex Business Model Canvas, which I am the creator of, I don't see how we could be able to collaborate and be successful as a society.
Hey, AT, is this a good segue into the next steps and the coaching sessions? Could this be a good topic for a coaching session, I'm thinking?
Sure, yeah, and Alvin, thanks for chiming in there. I think, you know, to your point, we may table that connection as a follow-up. So folks, Alvin's offered some advice and help there for folks on the call to reach out directly. But yeah, maybe let's transition. I know we only got 15 minutes or so left to some of the process side. I know there's some questions on the process as well.
If I could just, I want to make sure before we dive into process, just if anyone has any more specific questions for Laura, again, I love the tabling of that, but I want to make sure you all do have an opportunity, and we'll get to the process. And I saw one came in from Casey, kind of about deliverables and like the 13 weeks. But before that, specifically to this problem, just because I want to make sure you've got Laura here. If there's any other, if someone has a specific question about this for Laura or for Isabella, of course, I just want to make sure I didn't miss any questions and we didn't leave anyone out for that. So I'll give you just, if you chat them in the group.
Can you hear me?
Andre, sure. Yeah.
Okay, awesome. My question is regarding the peak flow rate, and do y'all have any data regarding the age at which a kid can effectively use that device, to kind of give some indication of, what stage they are in an asthma attack? Is it like 5 or 6? Because, telling a child to blow into a peak flow rate, has its difficulties sometimes. I had childhood asthma severely, so I'm just looking at the practical approaches as far as using that system and how maybe things could be built off of that.
I feel like that's something we can certainly get from the pediatrician, but I think your point is perfect, though. That's a perfect example of what we're trying to help the children understand, why you would need to do that and what that, what's a fun way to educate, and what number do I have to reach with my, when I'm doing this peak flow, all those things. So yes, we can get that information for you. And yes, what you just said is exactly what we're trying to help the children understand what they have to do. So I like your question, and yes, we can get that information.
Thank you.
Great. We've got another one here, just kind of talking about your impression of the current digital literacy level of both children and adults in the community. So maybe starting at your community and then of course going at large, but what are your kind of thoughts on that?
So, supposedly the information's written on a 5th grade level, but I do know that when you talk about health literacy, sometimes words are not where they get the information. A lot of pictures help more, and that is something I do think we have a little deficit on. The wording maybe at a lower level, like I said, it's written at 5th grade, so you don't catch those 1st graders, 2nd graders, 3rd graders with the current information. I would have to look a little bit more at what they're using at the camp that they have, but it's probably a little lower. But I think there's room to improve upon on that.
Okay, great. Thanks for that. I saw, Alvin, you posted some info, so thanks for that. Are there any other, we've got about, just under 15 minutes left here. So we've still got some time for questions. Maybe we'll kind of shift over to AT. And then if you guys do have more questions, feel free again to put them in the chat and I'll kind of review them. But AT, if you want to, this may be answered. I'm gonna kind of ask this one question and then that might be covered in what you're talking through. But we do say walk through a bit of the timeline as well as expected deliverables after the 13 weeks are up. So that you might touch on that, but that might come later. But I'll leave that one with you and kind of turn it over to you, AT. Oh, you're muted also.
Great, thanks for that that segue. And I think, a couple slides here we can show to help just frame that as we move forward. So again, just a reminder for folks, and we touched on this last time, but we mentioned the 13-week program. And again, here's the outline, right? Phase 1, phase 2, and then the beta test moving forward. We're heavily focused on phase 1 right now, which is some of this information gathering, understanding, do I want to propose on this solution or not? And again, this doesn't mean that you have a perfect solution crafted at this point. This is just, I've learned enough to say, 1, I am interested in proposing on this, as well as 2, here's my approach to how I'm going to continue to go deeper and solve something. So, we already had the event last Thursday night. Today we're having the Q&A sessions. And again, a good question from earlier, right, is if you're interested in the Rising Risk Predictive Modeling Challenge, the Q&A for that will be at 2 p.m. this afternoon. So anybody who's interested in that one as well. And then the next 3 weeks, we'll have coaches' office hours where Isabel, myself, Christopher, a couple folks will be on those calls to answer process questions, more detailed questions around how should I maybe structure this in my proposal? What about X or Y or Z? And we can relay some of those to the team. And then the 28th is the proposal submission deadline. So if you're interested in proposing, the 28th, so in a couple weeks at 5 p.m. on our website, there's a place to upload the PDF of your proposal. And we'll talk about here in a minute, what are the things we'd like to see in that proposal. And then a week later, announcing the finalists. Phase 2, I won't go into all the details now, but again, the idea is this phase 1 is open to everyone. Phase 2, a couple of finalists will be selected for each challenge. And then we'll spend 8 weeks working with you to refine that approach, that potential solution, so that at the Forward Pitch event on October 29th, those finalists will present back, similar to how we did last Thursday, to a room, an open room of investors, ecosystem folks from Navicent on your proposals, and they will select a winner at that point to move forward into the third part, which is the beta test, where again, pending the nature, it's too early to say the specific timeline of that, but pending the nature of your solution and what you're proposing and what it takes to get going, there'll be some prep period and then a period to launch and conduct the test there as well. So that's the high level. I'm going to now spend probably the next couple of minutes going deeper into phase 1, just to reiterate specific next steps. So again, the coaches' office hours, the website will have the link to the Zoom for those. They're 3 to 4 p.m. the next couple of Wednesdays. Submission deadline, that's on the website. We'll announce the finalists on the 4th. And then if you haven't done this already, a lot of you have already filled this out, which is great. We have a declaration of interest form on the website on the resources section. That just helps us make sure, if you're even thinking about it, it's not a commitment, but if you're thinking about it, that helps us make sure we've got your email and contact info to keep you informed of all these events and any other information that comes out and can be shared on the challenge. So please fill that out if you're interested and have not done that yet. We have these couple forums to answer questions. There's also a place on the website as well where you can post specific questions there that we'll see and can respond back during these office hours and other sessions. And then lastly, the submission package, which I'll talk about here in a second, of what we're asking for as part of the proposal submission on August 28th at the end of phase 1. So what we had in the proposal is we've decided to make it some guidelines of things we want in there, but not overly prescriptive of these 10 slides, these specific forms to fill out. We wanted to give you some flexibility and creativity to tell your story. There's some basic stuff of, your company, your team overview, how many people are on your team, what's your background, how many employees you have, how much revenue you have, how many customers, any of the things like that, your contact info, which of these challenges you're proposing on. So we do ask if you're proposing for both, you make 2 separate presentations for each. A little about your approach overview. And again here, since this is phase 1, we're not expecting that you have a fully baked solution necessarily. We're interested in even just your approach of how you're thinking about tackling it, what angle you're going to go after it, how you think it solves that problem. So back to the problem match as well. So a lot of detail around understanding of the problem and how your approach could solve that. To start getting ahead as well, just thoughts of, hey, what you would need to prove to demonstrate this in beta in terms of how you're going to measure the effectiveness or what data you need from Navicent Health to help measure that. There's some good questions about the baseline versus going forward. So starting to list out some of those things that you would need to establish the baseline and measure the effectiveness going forward. And then lastly, because this is phase one, important assumptions. There's going to be some assumptions that you're probably going to need to make or want to make or are making. And just be clear to list those out, right? To say, hey, I'm assuming that they have X, Y, Z to help me build the model. Or I'm assuming that this is the target range for this. And those may be right or wrong, but at least that helps us see what you're assuming, both about Navicent, about your program or your approach, and can help us as we move into phase two. And then lastly, understanding that if you are selected as a finalist, you would be willing to move into a beta test in January if you were selected as a winner. So let me pause there. There's a couple things, but it's still pretty open-ended in what we're looking for. And then again, on the website, there's a place where you can upload the PDF and submit your proposal. But let me pause there for questions on process or the proposal submission form.
I have another quick suggestion, I guess. Will the companies or the finalists that selected, I know the government has like SBI, IR grants, available. Could potentially, we be supported in going through that process of getting access to that money? Because, it's an expensive, I wouldn't say expensive process, but it's a very tedious process to apply for a government grant. And this is just a suggestion if it's not already thought of, just having that support from, the organization to help go through that process as a way of getting some sort of like free money or at least the opportunity to it, to help through the funding process.
Good question, Andre. And, that's part of the, we're not tackling that in phase one, but for phase two, for the finalists, to your point, I think Isabel mentioned this earlier, there's lots of different types of funding and ways of getting funding. And I think those would be part of the discussions we can have in those coaches' office hours during phase two that may be specific to a single company proposal or broadly across all of them. So funding is definitely something that I know will be on entrepreneurs' minds.
And yes, AT, we would definitely consider going jointly into a funding request.
Great. Any other questions specifically around this process? I do have one question to circle back for Laura, but anything specific about like kind of those coaches hours, the timeline right now in phase one? Laura or Isabel, could you go to, that I was going to say, these are some of the key dates if you are looking to come back. Now we've got your emails. So on the 12th, the 19th, the 26th, those will be opportunities for you to continue to connect. Maybe if I can circle back to Laura, if you guys do have more questions, feel free to chat. But one of the things that Katie wanted to clarify back to her last question is really more about how comfortable or not the adults and children in the community are with using and figuring out technology. Both that would mean maybe around computers, around smartphones, or lack thereof. So you were speaking to the levels a little bit, but can you kind of talk about more like comfortability around that, both adults and children?
Okay, I feel like they're comfortable, and I'll tell you why I say that. When COVID hit, we had to go into an instant rollout with telemedicine on our rural health clinic, which is located in Fort Valley. I didn't think it was going to work very well. I had my doubts. I was afraid that people didn't have the technology to do it. I've been pleasantly surprised. Our patients are doing it. So this would be the parents and the grandparents of these children. They are doing it. Now there is a little going back to the broadband, there is a little drag, like when we're trying to do like a face-to-face telemedicine visit, it's a little drag and delayed. So that part is, I do see that part, but as far as adopting it and participating with it, it has been really great, actually. So I feel like there is a lot of adaptability and willingness to utilize that. And, everybody pretty much now has a cell phone. Seems like. I hope that answered it.
It would be interesting to hear from the school and how, we all had to go remote for a couple months towards, March through May. And if they have seen, a ramp up in terms of the adoption of technology, if that has improved, it would be interesting to hear from the schools. And, I don't know who to reach out to, but Laura mentioned we have the school nurses. So we do have some ins with the school, but I'm thinking, those kids and their families had to use technology to be in school remotely for 2 months. So it would be interesting.
So I actually talked to the superintendent Friday about that, because, as we move into the next school year, there's a lot of discussion about how they're going to do that. And they are using half, I think he said they were going to do half in class and half remotely, virtually. And, again, just the broadband is the biggest concern about that. And they're, but willingness is there. It's just, it can't be something that takes a lot of, bandwidth.
Hi, this is Krista.
Go ahead.
Quick question. What if we already have an SBIR pitch approved, is this something that, if selected, the project is interested in participating in as a subcontract of that?
I must admit, I don't know enough about SBIR. I've heard of them in the past, and I have not worked directly with them. So that is, Krista, that is a question that I would have to look into and get back to you about. Do you think it's something that I need to explore with compliance or legal within Atrium?
Most likely, yes.
Okay. I will ask them. Thank you.
Yeah.
Great. Well, I don't really see any more questions, and we're coming up on 11 o'clock. I want to be mindful of time here. So, of course, we have all of those forms on the site under resources. And I know some of you guys will actually seen a lot of you come in. So we'll see you later today at 2 o'clock for another session. But if there's no other questions, we'll go ahead and let you all go. And then, if you haven't submitted the declaration yet, please feel free. And of course, take a look at the next steps on our site. And follow up with, Isabel, it looks like you've got a little bit of follow up there. One good question I did want to cover is, how will we kind of be able to get these resources? Will that be some of this data you've talked to, will that be in phase 1 or phase 2 that we're sharing some of this info out, that you talk with a pediatrician, or any of the guides that they need from us?
We can share in phase 1, right, Laura? Like right away. I mean, give us a week, maybe.
I mean, it's not any kind of, patient information, or, there's no HIPAA or anything like that. So I think it should be fine. Yeah.
Great. We can make that available then for folks, and then make sure we share that out. So, okay. Well, I want to thank you all for joining. We're really excited that you guys have all shown interest. It's a great group here. And so please feel free to reach out if you do have any questions. But if not, thank you, Laura, for joining. Thank you, Isabel, and everyone for your questions. I'm really excited and to see what you guys come up with.
Thank you all very, very much. I appreciate it. Bye-bye.